Buenos dias to all of you. We're almost in the month of August, and I think many of us did not expect that we'd still be in the same situation with shelter in place that we are at this point. And for a lot of us, it's really been a challenge to stay at home and not participate in a lot of the things we're used to participating in. And I think for people served by the Regional Center and their families, this has been a particularly challenging time. And I want to acknowledge that for all of you. If you don't know me, I'm Lisa Kleinbub, the Executive Director at the Regional Center of the East Bay. And by background and training, I am a registered nurse, so sometimes I have a little bit of perspective on some of the health issues that we're all facing right now as well. I'm going to start today with a PowerPoint presentation, but I want to share with you today what we are expecting to see as we move into the fall in terms of services that are considered non-residential services. And this is the result of directives from the Department of Developmental Services. So my intent is to walk through the PowerPoint, and after that, we will take questions primarily in the chat. However, if you want to raise your hand and ask a question, we can do that as well. So let me start with sharing my screen. And okay, so I hope you can all see my screen. Today, I want to talk about the non-residential services and what we're expecting in September. And right now, I just want to share with everyone a little bit of the numbers we are seeing on COVID-19 in the community. Statewide, the Regional Center population is about 354,000 consumers. Right now, there are 1,540 cases reported as of 7/28. There have been 91 deaths of individuals served through regional centers across the state. At Regional Center of the East Bay, where our population is 21,388, we have had, as of the 28th, 36 reported confirmed positive COVID cases among our consumers, and there have been 2 deaths. The people reported positive are those who we have gotten reports either from a service provider or from a family member that the person is COVID positive. We believe the number is slightly higher, only because so many of the people we serve live with their families, and they may not be reporting this as to us on a flow basis. We may hear about it a few weeks after the fact. I'm going to show you a little bit of data about COVID-19 and how the cases are breaking down by race and ethnicity. And I'm going to really just start with the Regional Center of the East Bay, of the Regional Center data on this, if this website will open for me. Let's see. Just stop the PowerPoint a minute and let's see. This is the most recent data on COVID-19 for Regional Center consumers across the state. And For all regional center consumers, the shaded area is their percentage of population. And you can see across the state, 9% of regional center consumers are Asian, 9% are African American, 40% are Latino, 30% are white. And what we see in the numbers is that there is actually, of people diagnosed with COVID, there appear to be lower than their share in the population cases in those who identify as Asian and those who identify as another race. Among the Latino population, we are seeing a higher percentage than is in the population as a whole. And if I showed you the statewide figures, we would also see that as what was going on. And the other thing I just wanted to show you about statewide data, and it really shows how it's breaking down and the risk of people living in group settings where they're exposed to more people. 81% of our consumers live home with their families or in their own home. 42% of our cases of COVID-19 are among that group. If it were distributed normally in a normal distribution, you'd expect 81% of the cases to be with people living with their family, and less than 20% with those living in out-of-home arrangements. But it's really quite different in terms of what we're seeing. And for Regional Center of the East Bay, we have approximately 6% of the population served by regional centers. We have 2% of the cases of COVID among regional center consumers. And I think that's because we are in an area that has less COVID positive cases than other places like Los Angeles, which has much higher case rates than we do. So let me move on to things that are going on with COVID in the state. There have been changes in testing and recommendations for testing. Right now, the prioritizations are those hospitalized and when they're investigating outbreaks of COVID-19. The second level of priority for testing are people with COVID-19 symptoms and those in close contact with those who have a confirmed case. And then if you're asymptomatic and you live in a congregate setting where you've had some exposure, if you work in a congregate setting, if you work in a correctional facility, which would be a congregate setting, those would be higher level priorities for testing. We are not able to get testing for Tier 3 and Tier 4 at this time because there is so much demand for testing among the higher tiers. And the problems with testing seem to be that there are not enough supplies for testing available to complete it, and that the labs that are doing the majority of testing have such a surge in number of tests that they haven't been able to keep up with getting people tested and getting results in a timely manner. What we are seeing in the community is numbers of COVID-19 cases increasing in all Bay Area counties. Over the last 2 days, we've seen fewer deaths in terms of an increase, and we've also seen a little bit of slowing of positive cases, but you really have to look at that over a long-term 2-week period. The governor issued directives a couple of weeks ago, which I think are important for all of us to pay attention to what is behind those directives, and those are directives on schools. And the governor directed that schools remain closed until a county is off of the state monitoring list for 14 days. And that means that they have a lower number of cases for a long period of time, and their testing positives are below 5%. Right now, all of the Bay Area counties are on the monitoring list and would have to be kind of achieving the levels required for 14 days on that list, and then they would come off the list and there'd be 14 more days. So in the feeling of having people in group settings right now is that it's not quite safe when they're indoor settings. And there's continued caution on physical distancing, wearing masks, and hand washing. And I think I'll also emphasize when we're socializing to do it outdoors. Now, during the state of emergency, which the governor issued, our non-residential services funded through the regional center have been receiving, with certain requirements for documentation, what are called retention payments. And those have been paid to providers based on their attendance in the past year. And there has been an expectation that the providers receiving those payments will continue to pay their staff and will continue to provide services via alternative means as much as possible remotely. And the funds for those payments were supported by federal dollars from Medicaid for anyone eligible for Medicaid through July 15th, 2020. There will be new requirements for what the providers have to do starting September 1st, 2020. And we received a directive from the Department of Developmental Services that proposes an alternative delivery framework for services after September 1st, 2020. And one of the important things about this framework, it's not one size for every individual. It's intended to be applied with a person-centered focus, and any service alternatives and modifications are required to be informed and driven by the person receiving services and both their wants and their needs. And the modifications are driven by a goal to maintain federal funding, which is a very important component of how services in California for the developmentally disabled population are supported, and to have services delivered based on consumer preference. And as we move into September, services that will be eligible for reimbursement will be supports related to managing COVID-19 risk, completion of individual assessments, person-centered plans, remote services delivered by telephone or video communication, delivery of supplies and other materials to the consumer's homes, confirmed use of self-guided materials, services provided in person at the consumer's home, services provided in person at a community setting, and services provided in person at a provider facility, and supports for those transitioning to self-determination if applicable. Providers during this time are going to be required to maintain phone and email access to respond to needs from consumers and families, to maintain documentation, to submit quarterly reports, and to maintain documentation of staff training, which may include things around person-centered planning, informed decision-making, alternative communication methods, and so on. Cultural and linguistic competencies will be another area of training that's allowed. In-person services. Those may only be provided if in alignment with the most restrictive state or local guidelines. So that means in both licensed settings and in other community-based, facility-based services, it will be important for those services to be in contact with both community care licensing, local public health departments, and really looking at what the state is saying about services and how people can congregate. For consumers and families, aside from directives issued, there is material that will be delivered shortly that should be coming in a variety of formats and multiple languages so people can access this material. And providers who have best practices around remote service delivery are expected to be sharing their best practices with those who haven't provided a lot of remote services, sharing ideas about how to best serve people during this time. Provider payment is going to be a payment of a full daily rate for each day that a consumer was provided one or more of the identified supports, or if it's an hourly service, an average number of daily hours used in the previous 12 months for the individual supported. And so if someone usually went to day program 5 days a week, and the person continues to get services 5 days a week in this alternative model, the provider would be able to continue to be funded for services. I want to talk about other extensions of directives. And one that I don't have listed here is a directive that we do expect to be continually reissued from the department, which limits the ability of those who live in some specialized homes, mostly for people who are medically fragile, to attend outside day programs. It includes people living in nursing facilities as well as those living in something called an ARF cushion for medically fragile folks. It also limits participation in congregate settings for those who have chronic health conditions. And some of that, of course, will be considered on an individual basis, but that underlines some of the protections that are laid out in department directives. There is a continuation of an allowance for remote service delivery, which is by telephone, by video, and that sort of thing. There is a provision that allows regional centers to develop IPPs and IFSPs remotely. There is a continuation of a directive for participant-directed services, which is more flexibility around individuals working through a fiscal management service and hiring people that they've identified for different services. And for early start, when children have not been able to transition to their local education agency, that would be the school district after age 3, regional centers will continue to work with the family and child on that transition. But if that hasn't happened, we will be able to extend the early start services that were in the IFSP beyond the 3rd birthday. And so now I'm going to stop screen sharing. That was a lot of information. And I will be welcoming any questions that you have. I see we already have a number of questions here. And there aren't always answers yet. We are submitting questions to the Department of Developmental Services as they roll out these directives. And we do expect that there also will be some new regulations to implement these changes for our service providers. So I'm going to go first to a question from Jeff, about someone living independently who is only getting services remotely, and concerns about health and safety and putting someone at risk. And I'd like to encourage you, if someone is living on their own and there is a concern about them needing more direct services, please go back and contact the case manager. We will work on those, because when there are essential services which need to be provided directly, including in-home support services, including personal care, including some sort of direct contact for certain services, there are ways that those can be provided safely. And we're also encouraging, as much as possible, following the mandates, for some services to be provided outdoors where social distancing can be occurring. And we're also have access to quite a bit of personal protective equipment, which has been provided to both residential homes, day services, families, as well as ILS and SLS providers. I have another question. If we're going to have a copy of the slides. Yes, the slides will be posted on our website, as well as a YouTube video of this presentation today. Can day programs provide outdoor programming which are in sync with the county requirements for safety? I think that is one area, that's a great question. I think that's one area that some of our programs are looking at as they move forward with these new directives. I would see that it could be small groups to go to a park for exercise. It may not be a full day of day program attendance, because you have other sorts of issues, including people needing to get out of the sun when there's not indoor spaces to go to. It includes the issue of transportation and who can walk to a site or go out and do certain things together. But that is certainly something that our day programs are looking at, and people as a whole are looking at as ways to start doing things. I know a lot of gyms are running exercise classes, so I do see that as a really reasonable option. Let's see. So I think that there's a question about services for those with severe disabilities who cannot benefit from virtual meetings and need the routine to go to a day program. I think that this is a group that there is a lot of concern about, because a lot of the remote services have not been able to connect. And so I think what we're looking at is there a possibility of a more one-on-one service where someone serves the person only, and where it's not a congregate setting at this point in time, where someone can come into a home to serve someone if they're living with their family. In our licensed residential facilities, the facilities have been providing programming as part of what they're doing during the day, and we've been supporting them in that. And I think especially for people living with their families, where they really want more connection and intervention with their family member, that is something we will be looking at. It is always the balance between inviting people into one's home and what people are comfortable with, as well as then getting the kind of intervention and services that people want. In almost all of the situations where we have seen COVID-19 cases in our licensed facilities, it has occurred at the same time as we see staff testing positive. And so it's a really big question, when most of our consumers in licensed settings have been staying home, what the route of the virus being brought into the home is. And we think it's a lot of staff coming in. So we want to minimize exposure to multiple individuals as much as possible. See, the next question is respite by Zoom approved. Respite is seen as an intermittent break, and so it has not been seen as something that could be provided by Zoom. However, I've seen some questions about that over the last few weeks about whether if someone is on some sort of activities via Zoom, does that provide some sort of break for family members so that they are able to do other things around the house? So that is something we do have to look at as we move forward, because I can see how that would be helpful for a lot of families. Many of our respite providers have been serving people in their family home if that's something that's been mutually agreed to. So good question, and that's something I will take that back. My son was involved in group employment in an outdoor setting prior to the pandemic. Why can't this continue? I don't know about the group employment outdoors, but I think that we will be seeing providers start to introduce that as we move to these alternative delivery models. And part of the reason why a lot of programs can't provide some of the outdoor activities depends on ratios and whether, if they were site-based, how many people can they serve outdoors versus at that site. And so I think those are things they will be looking at, and hopefully those can start to occur. Let's see. The directive mentioned self-certification by providers for remote services. Will there be any verification by checking with consumers and families? We actually don't have all of the requirements for what's going to be required for providers as they provide these services. The self-certification refers to them saying, a service provider saying, I provided services on this and this date. We haven't planned for an audit process, but one of the most important ways we find out whether someone's been receiving what it is said that has been provided is by someone telling us. And so if a consumer feels that they haven't gotten what the day service is saying they've received, please let us know. That is one of the reasons why something that comes out once a year, which is an annual statement of services provided. It gives a list of services that have been billed and paid by the regional center. And sometimes we hear that what was billed wasn't exactly what people thought was provided, and it gives us an opportunity to look into that. I do think there's going to be, in the month of August, before these go into effect, there's going to be conversation between people served and their service providers and their case managers as to what services they want to continue to get, what they would like to see in the future, and how we can work to get those services in place. I have a question, are ILS services non-residential? You know, that's kind of a gray area. ILS services are not seen as providing care and supervision. So they are seen more in the realm of being non-residential, in that they don't provide support, the overall supports for daily living. People who receive ILS may not need a whole lot of other supports for their overall living, but they also may live still with family. They may still live in a licensed residential program. And so it does depend with ILS as to how they're seen. In our regional center, ILS is primarily seen as non-residential. Supported living services are seen more in the realm of a residential service. How will we know that day programs are following directives? It's a lot easier to continue Zoom meetings than to have person-centered services. We will be doing monitoring of these and making sure that what people are expecting to receive in terms of services are being received. I do think that it's a conversation about that, and I think one thing that I think we all need to understand is that I do not believe that anyone who used to leave for a day service at 8 a.m. because they received transportation or they took the bus and were receiving services at a site in the community for 5 hours a day and then spending time going home. I don't think things are going to look like that for quite some time. Now, the services may look more like someone spending 3 hours one day or 2 days a week in a park doing exercises, another couple of days getting some other sort of activity at home. So I think services are going to look very different because of the nature of the health risk right now. And those are risks both to individuals served and to the staff of places that are serving individuals. And so we're going to have to work on that. I think one of the concerns that I know a lot of families of younger children are having is with schools not reopening, it is what those days look like in terms of days for people who need care and supervision when parents are needing to go back to work. And we will be looking at those kind of daycare needs as we move forward. If services are only being delivered remotely to someone because of their health conditions, how do they get the remainder of their supports as we move on? So let me see if I have any more questions here. Open to any other questions, or if you'd like, if you're more comfortable raising your hand, I will do that. I see I have a Renee with a raised hand. I'll see if Renee is interested in asking a question. Hello? Hello? Renee?
Yeah. Yes.
Hi, you have a question?
Yes. How is it going to be when the Pleasanton Unified School District is open? How are they going to do social distancing for my internship? Because part of me wants to go, but part of me is extremely nervous about getting on Barton bus with the death tolls right now.
Mm-hmm.
And my question is, how are they going to do social distancing and in a setting like that?
What I do know, are you talking about in a school district setting or in a work setting?
The work setting, because they're going to be at the Pleasanton School District.
Yeah.
And it's a work setting.
Yeah.
My question is, how are they going to do social distancing where it's going to be safe?
Yeah, I think that what we're going to see is in a lot of school settings and other things like that, we're going to see a lot more plexiglass, and we're going to see people wearing masks, and also people being in much smaller groups. So if normally you would have worked in a group of 6 people, it probably will be a group of 3 people so that the space allows for social distancing. And I do know that a lot of school districts and so forth are working on figuring out what that's going to look moving forward. Similarly, people who are employed, we have many people who are employed in grocery stores and other retail businesses, and they are wearing masks and they are staying 6 feet away from anyone they're working with, or at least that's the requirement by the state. Let me look at a question here. Jeff, the lack of information from the program is creating anxiety for my son. Yes, we are going to, the providers as we move forward are going to be required to be in communication and to share information. And it's going to have to be a conversation about what the services look like in the future, after September. This is going to be a requirement, and a lot of the materials that are going to come from the state to discuss the services are something that we will be talking to service providers about sharing with the people they serve, and then being able to discuss those with them. And so I will be talking to providers in the next week or so, and we expect more directives out about that need to really communicate clearly with the people they serve about what's going to happen. There's a question here about how old do children need to be in order to still receive respite care? Is there an age limit? Our respite is an intermittent break for a family members who provide a lot of care and supervision above that, which would typically be provided to that family member. So if you have a teenager who cannot travel alone in the community, who cannot provide their own safety, knows not to open the door, that sort of thing, that person would still be able to receive respite, their family would be, as well as adults who really do need supervision in the home or in the community, and their family members cannot get their own break without having someone to provide care and supervision. So we provide respite services for all ages. And actually, because all children require care and supervision, it's more common for us to have younger children who have care and supervision needs that are very similar to other children their age who don't receive to do those services. Brian, there's a question, what happens if the day program refuses in-person type of participation for the consumer? I think if we're having a day program that can't provide a service remotely to someone who will not be able to participate in a day service, we may all have to look at if there's alternative services. And when I spoke about participant-directed services or other types of services we may be able to put in family homes, that may be the type of service that we are able to support someone with. It may be that having staff come into a family home is not the right option. There also are probably going to be a number of day services who will be able to do that. And so we're going to have to look at what is possible, because at a certain point, we really do need to not just have absence billing, but we do have to have people getting some services as well. And what used to be delivered may not be what can be delivered at this point, and we may need to look at alternatives, at least for this period of time that really meet people's needs. Brian, I hope that answers your question, but feel free to shoot an email to our Write to Us email if you have any other questions about that. Let me see if there's any other questions in my chat. Okay. So I will end this in a few minutes unless there are any other questions. I encourage you to go on our website. I think I showed you a week or two ago our new website, and sign up for our email. And I expect that our next community meeting will discuss more of the questions I'm hearing here, which are, what do we do if the person who is getting services can't access the day services the way they're being envisioned, and we need something else. And I think that we might want to answer questions as well about respite services and daycare. And feel free to use our Write to Us feature to ask us any questions or get your questions forwarded. So I see that there's a behavior tech who wants to run small socially distanced groups for SLS clients to socialize and get out of the house. That sounds like a wonderful idea. And I think in terms of a group, it would depend on who was part of that group. And so if the people who were part of that group are people who would typically be able to be in a group in another setting, then I think doing that outdoors in a 6 to 8 person group, if the setting outdoors is large enough, would be great. I think that what we are hearing from the counties varies between 6 and 12 people in a group. And I think some of that can be kind of individualized, but I do think any groups to talk, and I also think any groups to exercise and to take walks and do those sorts of things is a really great idea for anyone who really enjoys that. And I think it has added mental health benefits as well as physical health benefits for people to do that kind of exercising, as long as that works for them. And I think I will let you know that all of our day service providers are meeting every week approximately to really share solutions, and I will move that on as to something that people really want to see. I have a question on translating. Thank you for the translating, and yes, thank you, Jairo. I really appreciate Jairo's translation, and Etta, who also translates for us, so we can get translations done. And then I have a question as to whether we'll be extending additional childcare hours past 8/31/2020 to help families who have children. And yes, we're going to be looking at what the individual situations are, because there are many parents who do have to be working, and we are going to look at those on an individual basis depending on what the need is. That's the same both for children as well as for adults whose family members are having to work outside the house. I do see that there's a question about the differences in day programs and how they provide services. And I think there is a large difference. Some providers really got up to speed and really learned how to do the Zoom kinds of things, and others did not. And I think that part of what we're going to see is that the programs who did not are going to have the expectation that they do. And part of the directive really requires that staff be trained and that staff are learning from other people who may be a little further ahead. One of the other divides that we have is access to the internet for some individuals and their families, and to devices. And that is something that we are looking at as to how that can be supported, either as something that is available to the individuals through a day service, or is available to others as who need those, maybe who get ILS services, who need that kind of device. There is a focus on looking at additional technology. There is a question when the new approval date is for participant-directed services. I believe that the participant-directed services were extended last through the end of August. Many of the directives that the Department of Developmental Services is issuing can only be done in 30-day increments. So we are seeing a lot of updates on directives every month. I would tell you that my expectation is that these directives, until the state of emergency is over, are going to continue to be extended. When we see a surge reduction and when we see really the curve flatten and children returning to school, we may see some changes in these directives. But until that happens, and maybe even until there's a vaccine, we will see these things remain. The other thing is that some of the things that have worked well during the pandemic, for some people, remote services have been something they've wanted for years. They may continue, and we may see some of the things like participant-directed services, some of the remote services available after the pandemic. And for some of these, that will be great. And my direct email address, please use the Write to Us function that on our website that will give you direct access to myself and staff, and we will follow up on any questions that you have. So I'll wait a little while longer. There's a question about where I can get more information. Please look at our website, and if you use a language other than English, you can translate almost all of the information on our website. We are really trying to make that very easy to translate and getting everything at least into the threshold languages in our counties so people are able to read the materials that we post. And hopefully there'll be some other alternatives to just reading things. Hopefully there'll be some more videos and stuff to explain the services. I'm hoping for that. So thank you everyone for joining, and feel free to shoot some other questions, and I'll be back in, I think, 2 weeks. I'm trying to do these every other week right now. When the pandemic is over, hopefully we'll be able to go to once a month, but I like doing this and I like hearing your questions because it allows us to know what's working for people and what's not working for people. And I think that's the way we can learn. So thank you for joining, and bye-bye for now.